Well, good morning. We're very fortunate to have such a nice day today in between storms. So thank you all for coming and joining us this morning. My name is Wade Knutson. In addition to serving as a vice president and Portsmouth site leader at Raytheon Missiles and Defense, I'm also a Portsmouth neighbor. I'm excited to be joined by Lieutenant Governor Dan McKee, Stuart Freeman from the Rhode Island Alliance for Business Resilience, and Rich Raynor, the town administrator. And we're here to commemorate the opening of the first community vaccination site, point of distribution, or pod, for the town of Portsmouth. At Raytheon, taking on the world's most challenging opportunities goes beyond business operations. Today is about our local community and providing vital resources to those who need it most. This pod is a community-organized and community-facilitated event. Raytheon has a great history with the state of Rhode Island, and when the town approached us about helping out and to provide space to assist in this effort, we happily jumped in. Within weeks, our team retrofitted over 10,000 square feet of space for Ray and his team to set up operations. Our team worked tirelessly to meet a tough deadline, and I can't thank them enough for their efforts. Today is also a proof point for public-private partnerships. Having the infrastructure to deliver and administer the vaccine safely and efficiently required an all-hands-on-deck approach. We take our responsibility to the community seriously, and partnering with state officials, organizations like the Alliance and the town of Portsmouth to make the vaccine available validates the power of that partnership. And with that, I'll turn the podium over to Governor McKee.
Thanks, Wade, and thank you so much for your leadership. Thank you for your leadership and your team here. You know, to get this done, and this building hadn't been, you know, to repurpose it the way you have as quickly as you have. Congratulations to you and to your staff. It's great to be here today with my fellow colleagues and senators and reps and town officials. A great way to start the day here in Portsmouth, talking about how municipalities can actually play a significant role in the vaccination strategies as we roll it out over the next several months. So we know that it's important to have the local communities involved. Today I'll be stopping by Cranston and also Johnston's facility that are now vaccinating the 75 and olders community in our community. So I want to thank Town Administrator Raynor for being here and his team, you know, to help facilitate this. We've been on calls now for the last few weeks with municipal leaders around the state of Rhode Island as we prepare our efforts to get ready, you know, when I become governor in the short order. I think has made it very clear this week that speeding up vaccine distribution is a top priority, and it'll be a top priority of my administration as well. When I become governor, I want to be able to improve distribution, and right now my team and I are gathering that information to make that happen. I've been spending time in community visiting. As I said, I've been in Central Falls. I've been at Cranston State Site, which is a fantastic facility, very efficient. I visited the Dunk last week as well. And today we'll be visiting municipal facilities that are set up like here at Raytheon for the people of the town of Portsmouth. And as a former mayor, I understand the input of all 39 cities and towns is very important. We're in a crisis right now. We're in a health crisis, an economic crisis, a crisis for our students, and also a crisis in terms of making sure that we have equity and justice for everybody that lives in the state of Rhode Island. And that's why I'm here today. Over the last few weeks, we've been able to assemble I think a top-notch COVID response team that I call a community advisory group with national leaders as well as local and state leaders and people who actually have their feet on the ground. So we're going to make sure as the work ahead. I'm grateful for all our partners that we have in the state and the local level and within our business community, and I want to thank Raytheon again and everyone here for helping get shots in arms as quickly and safely as possible. So I would like to introduce now Stuart Freeman, Project Manager, Rhode Island Alliance for Business Resiliency from REMA, and the podium's yours, Stuart. Thank you.
Thank you. On behalf of the Rhode Island Emergency Management Agency and Director Mark Pappas, it's an honor to be here today with such a distinguished group of people for this important event. Some of the newest thinking in emergency management has been to acknowledge that emergency response is not just the domain of government, but takes the entire community. Over the last several years, time and time again, we have learned that the public sector cannot do it alone, and that the private sector, the business community, has unique resources and the willingness to assist. Getting communities back on their feet after a disaster is as important to business as it is to government. Never has this been more apparent than during the COVID pandemic. From cooperating in the shutdown of our economy and the novel ways that the business community created entirely new work streams, to fulfilling the tremendous needs for PPE, resources for COVID testing, and the production and distribution of the vaccine. Business has been working together with government, federal, state, and local, to respond to the pandemic. In Rhode Island, we recognized the strength and importance of this collaboration several years ago, and at the time looked to develop a more formal relationship between emergency management and the private sector. One of our efforts was to form a private-public partnership called the Rhode Island Alliance for Business Resilience, born of a shared vision for private-public collaboration in emergency preparedness, response, and recovery. Raytheon saw the importance of this and was one of the 9 founding members of the Alliance. Working together, we have learned how to communicate during emergencies and pool resources for state and local needs. As emergency management professionals, we recognize that with planning and cooperation, this can happen more often and more deliberately, which brings us to this event. We applaud Raytheon's efforts in teaming with the town of Portsmouth and Ray Perry, as well as the Rhode Island Department of Health in undertaking its participation in the COVID vaccine distribution. These kinds of initiatives are critical to emergency management response and recovery, and most importantly, in working together to overcome the pandemic. We look forward to a successful outcome and hope this becomes a model for other companies and communities. Thank you. And now I'd like to introduce Rich Raynor, the Portsmouth Town Administrator.
As called, I'll be very brief. I want to thank the Lieutenant Governor and his staff for all the work that they put into helping us bring this event together. I want to thank Raytheon. I want to thank Rhode Island Department of Health and Rhode Island Emergency Management Agency. But most especially, I want to acknowledge and I want to thank our Emergency Management Director, Ray Perry, our MedPOS Coordinator, Rich Talipsky, and all the volunteers that have stepped up, answered the call, and helped us put this pod together. It's all about Portsmouth. It's all about taking care of our citizens, and we're behind it 100%. So thank you all for helping us.
Thank you. Mr. Raynor, how many doses are you giving today?
Today we have 160 doses.
Is that enough?
Right now it's enough to get us through the 4 weeks of the initial doses for the 75 and older, but as the Lieutenant Governor has stated, more doses will become available in the coming weeks. We have more than enough space, more than enough volunteers, and more than enough vaccinators to handle that increase in doses as they come.
Governor? Yeah. 180 doses, the town administrator thinks that's enough. Do you think that's enough for the town here?
No, I think the mailing list is longer than that, but you know, time will certainly, as I've said in my comments, you know, we're preparing for when I'm governor, and we're doing all the research to be able to answer those questions, Steve. So
you were a little dissatisfied with the way this is all rolled out. Tell us about that.
yeah, I think I've made my comments pretty clear that we need to get more shots in the arms as quickly as we can, and using all the resources we possibly can, whether it's at the state level or with partnerships with CVS and Walgreens. And then I think this is my presence here today just, you know, supports the idea that municipalities are going to play a real good role.
You said you were going to reach out to the Connecticut governor, Harvard, other experts. Have you done this?
Yeah, so they're on the schedule. I'll be talking to them. That's part of the research that I'm doing right now to make sure that, you know, when I am governor, that I can hit the ground running.
You've mentioned
you were very complimentary, I guess, or you were okay with the rollout of the vaccines, and then you seem to have a change of heart. What have you learned that gave you a change of heart in Rhode Island's vaccination plan?
Yeah, so I think that the again, we're going to keep on doing this background check, and that's the reason I'm calling Harvard. How come they gave us an F, right? You know, I'm calling the governor in Connecticut. How come they are doing a little bit better, stronger than I? So it's all background that I'm doing right now.